Uganda has unveiled its post-Ebola recovery plan that will help survivors cope with the effects of the disease, but also control the resurgence of the viral hemorrhagic fever. The country is currently observing a 6-month mandatory period before it is totally declared Ebola-free by the World Health Organization. In September last year, health authorities in Uganda declared an outbreak of Ebola after a case of the Sudan Ebola virus was confirmed in the central part of the country. CGTN's Hilary Ayesega reports.
In January this year, Uganda was declared Ebola-free, but health officials say they are not leaving anything to chance.
We don't close shop and forget that another epidemic will occur. And it is not if, it is when, because it will occur. Uganda is in that, Congo basin where we are extremely prone to epidemics.
In the recent outbreak, Uganda recorded 142 confirmed cases and 55 deaths. The epicenter of the Ebola outbreak was Mubende and Kasanda districts in the central part of the country. But the origin of the Sudan Ebola strain is still unknown.
There are chances of a flare-up from the survivors of Ebola, but also in rare instances we have recorded a relapse. But as communicated earlier, because we also haven't yet pinpointed on the origins of this particular outbreak,
officials have drawn plans to avert any possible reoccurrence.
This includes establishing 6 mobile laboratories that will be very easily deployed and rapidly within 24 hours so that we can have testing taken nearer to where we have the outbreaks. To improve access to quality healthcare, and this is both by establishing a clinic which is already running to support the monitoring of the sequelae from those who have survived but still have some side effects after they have recovered, as well as providing a psychosocial support to these individuals.
Also under this plan, health officials want to support vaccine research. Uganda has 2 trial vaccines for the Sudan Ebola strain. Ugandan scientists are putting in place systems that will ensure Ebola is detected early and also prevent its rapid spread in the future. These plans are expected to cost about $34 million, with much of the funding coming from the World Health Organization. Hilary Ayesega, CGTN, Kampala, Uganda.